acquaintances, fathers, mothers, sisters, brothers, all of you, I greet you. I hope everything is fine. You are welcome again to this our program. I'm your host, Dr. Jolo, your host in my show, DJM3, Dr. Jolo Musical Medical Mission. You are welcome once again to this new episode, Dr. Jolo Musical Medical Mission. Today we'll be talking about a very, very important topic. It concerns only the men. The men concerns only the men. It concerns an organ that only the men possess, the prostate organ.
Hold on, sir. I need you to link it like you link. Last episode we did cervical cancer. And this week we'll be doing prostate cancer. This is about men. You have to feel like you have to sorrow more. Beg a link in. So come on, one play about So we are rolling. Take from the top again now. From the top. Next episode is prostate cancer. Dr. Jolo said, still on the show, DJM3. Action!
Wow. Greetings all. My friends, members of the family, ladies and gentlemen, our fathers, mothers, you are all welcome to this show again, DJM3. DJM3, simply put, is Dr. Jolo Musical Medical Mission. Once again, you are welcome, and I hope you are going to enjoy yourself as you did the last episode. If you remember very well, last episode we dealt with the women. We dealt with the cancer of the cervix. Today, we'll be talking about to the men. We'll be talking about the prostate organ. The prostate organ is an organ that is only possessed by men. The prostate organ is located at the base of the pelvis. It is located in the space between the urinary bladder and the rectum. It's not easily accessible, but it is there, and it has its function, major functions to carry out. The prostate, when a child is born, a male child is born, is very small, just like a kola nut. Very small when the child is born, and it's like that until the child reaches puberty. At the age of puberty, it starts developing because of changes in the endocrine system. It starts developing, and it continues to develop until it continues to develop throughout the life of a man. The prostate contains 5 lobes, 5 unequal lobes, and in between the 5 lobes there are 3. There is 1 exit and 2 entrances into the prostate. And as it gets enlarged, all the lobes increase at different rates. And as it gets enlarged, the tubes that pass in between the lobes of the prostate becomes more tiny, to the extent that at a stage when the prostate is enlarged, by the time a man is about 50, he may start experiencing some difficulty in urination. And this is one of the reasons why we are now concerned about the prostate. There is this saying in pathology that eventually, if a man lives long enough, he will have benign prostatic hypertrophy. If a man lives long enough, his prostate will enlarge to the extent that it will give him urinary challenges. There's nothing you can do about that. As the prostate enlarges with age, the orifices, I mean the tubes that pass through the prostate substance, they become narrower. And this is physiological. As they become narrower, gradually the man starts having difficulty in urination. This is what we call prostatism, difficulty in urination. When there is difficulty in urination, what happens when there is difficulty in urination is that the man will be going to urinate more frequently, and there will be increased frequency. He will be urinating more frequently, and with time, he will be having urge to urinate to the extent that he will be in a haste to urinate. Then, with time, there may initially there will not be pain, but with time, particularly if the man has had past history of urinary tract infection, with time there will be difficulty in urination. And these symptoms usually occur more at night. It is not uncommon for men folks that they'll wake up in the night to urinate about 2 or 3 times. It's not unusual. It's not that they have diabetes, but it's just as symptoms of these are symptoms of the enlargement of the prostate. And you remember when a child is younger, when a child is a toddler, some of them when they go to urinate, they are able they put their they want to urinate, they can form a fountain with their urine flow. But as they get older, the fountain will be coming down. This is because the prostate is enlarging. And as the prostate is enlarging, the ability of the phallus to shoot out the stream of the urine goes down. So it's an indirect way of measuring the enlargement of your prostate is to see how long your stream of fountain can be maintained. So mathematically put, I can say the the height of your fountain is inversely proportional to the size of the prostate, meaning that the higher the fountain, the smaller the prostate. Please you note this. Now, usually people with
Please
prostate.
note this. Usually, mop up, sir. Note this. Usually. Note this clearly. It's just going to mop up and get them. So usually, note this. So your voice, sir, please. Keep the pitch. Note this. Are you ready to go?
Yeah. Okay, sorry. Usually,
Hold on. Let me. Okay. Are you good, sir?
yeah.
Now pick it up. Action.
Yeah. As a man gets older, the prostate enlarges. And as the prostate enlarges, the tubes within the prostate constricts. And as the tube within the prostate constricts, the flow of the urine to form a fountain goes down. So, what causes prostatic cancer? Really, the enlargement of prostate does not mean one has cancer. It does not mean, because one can go about with the enlargement of prostate without having cancer. But when it becomes so much that there is pain, serious pain in urination, when it becomes so much that there is difficulty in urination, because this can be very, very painful. When it becomes so much, one has no choice than to remove the prostate gland. And the removal is usually done by a urologist who is very experienced. He knows how to go about it. You don't need to concern yourself how this is done, but the specialist will know how it is done. Now, usually when this surgery is carried out, the tissue, the prostatic tissue that is removed, is taken to the pathologist who will examine it macroscopically and microscopically and come up with the biopsy report. Biopsy report meaning the sort of cells that are found within the prostate substance. But in some of the cases, there may not be cancer cells. But in some cases, we can have cancer cells. And we've noticed that men that produce blood or urine mixed with blood when there is difficulty in urination, they tend to have prostate cancer. Although there is no way that we can say somebody has prostate cancer unless there is tissue biopsy. And so, when the patient is taken to the theater and the prostate is removed, the tissue sent to the laboratory, when the biopsy result comes out, that is when you will know that this is cancerous or not. Now, what causes prostate cancer? And I want to let you know that this cancer runs in family, and I want you to let you know that certain diets predispose people to have prostate cancer, and some diets include high fat diets rich in meat, and diets that are rich in foods grown from fertilizers. These are these are results that have been carried out from research. These are results of research that have been carried out. So, although there is a school of thought that believes that the more sexually exposed you are to, the more sexually exposed, sexually active you are, the less your ability, your possibility of having prostate cancer. Again, there is a school of thought that believes that the more sexually exposed you are, the less your ability to have prostate cancer. This is debatable, but I think it's not questionable. So, uh, most importantly, Most of the screening must be carried out. Screening. How do we screen for prostate cancer? It can be done clinically by doing a digital rectal examination. This can be done by putting the finger through the anus to check for the size of the prostate, to check for the lobes of the prostate, to check for the sizes and all the other lobes of the prostate. These are clinical findings that we may not need to bother ourselves with. But one of the laboratory symptoms, one of the laboratory tests that we can carry out is what we call to take the blood sample to measure what we call the PSA, which means prostate specific antigen. The level of the prostate specific antigen should not be more than 4. If it is more than 4, we may start thinking in line of the prostate challenge. It could be prostatism, it could be cancer of the prostate. But when there is cancer of the prostate, what's the treatment? It could be surgical, it could be radiotherapeutical. If it is radiotherapeutical, what we are going to do is that we use radiotherapy to burn the substance of the cancers. And when you are doing this, periodically the PSA should be measured. And usually when the measurement of the PSA goes down, it shows that the cancer cells have been taken from the body. Apart from all this, there can also be the use of hormone therapy. There is the use of hormone therapy to control the level of cancers in the blood. Ladies and gentlemen, or gentlemen I should say, and ladies of gentlemen who are interested in the health of their spouses, I thank you for listening to this. I hope you have enjoyed all this I've said. This is a very short synopsis of our knowledge of prostate cancer. I hope the knowledge will be useful, to be value added, and I hope you'll be able to help those that need it in this aspect. Thank you. We are ready for your feedback. Be afraid at all times. Listen, watch the TV, contact the phone number you are seeing on the screen. I'm always there to give you your answers. Thank you very much. Enjoy yourself. The best is yet to come. Ladies and gentlemen, we have fed ourselves with academic knowledge. Now, it is time for us to go social. Let's feed ourselves socially. Let's listen to some music. Have some music therapy. Enjoy ourselves for the next episode. Thank you very much. It is well. Cheers.